All right, let's talk about the very tricky experience of changing care providers. So I'll bet that many women watching this video can relate to the experience of just feeling a little off when you go to see your medical care provider. Maybe you don't feel comfortable asking them all the questions you have. Maybe you feel embarrassed to tell them about a certain medical condition that you have. Or maybe, and this is a really uncomfortable one, you just don't feel like you can totally trust them and their judgment. So if you have experienced any of this with your care provider, or your intuition just tells you, you know what, I don't really like them. I just want to see like what else is out there. First of all, and hopefully you already know this, of course you have the right to fire them, for lack of a better word, and hire somebody new. But just like it's really tricky to break up with a romantic partner, it can also feel really uncomfortable to like break up with a medical care provider. But first and foremost, know that going through that discomfort, and hopefully it won't be too uncomfortable, hopefully they are professional and realize that it's your prerogative to choose somebody that you resonate with more. Hopefully, this experience will allow you to have the birth that you want to have, because so often having a medical care provider that is not actually aligned with the type of birth you want to have, that you don't feel will support you in your choices, in your preferences, that can really derail a birth experience. I've seen it happen multiple times. I've seen women railroaded into decisions, into choices, into interventions that they really didn't want. And it made them resentful. It caused them to have to do a lot of processing about their birth afterwards. And a lot of them said, God, like I wish I had just changed my care provider. Like I felt that they just like weren't right, that they didn't get me, but I didn't make that switch because I felt uncomfortable. So facing a little bit of discomfort now and switching care providers, if you don't resonate with them, will save you a ton of grief further down the road. So how do you do this? First of all, you want to find a new care provider that you do resonate with. So a few ways to do this is read a lot of reviews. There's so many review sites out there now that allow people to share their experience with different care providers. Of course, take the reviews with, a grain of salt. Some people get upset for a ridiculous reason or whatnot. You don't have to take them all as fact. One of my favorite ways to find a good care provider is to talk to women that you know that had the type of birth that you want to have. So maybe you're looking for a midwife that does home deliveries. Maybe you're looking for a midwife that works out of a birth center. Maybe you're looking for a high-risk doctor. Whatever it is that you need, seek out those women that have had that type of birth and ask them who they recommend. Hopefully they have somebody that they felt good with, or can refer you to somebody else that hopefully has some good suggestions. And then go through the process of interviewing these medical care providers. Sometimes we have the belief that if we just go in for a consult with them, then because we took up their time, it means that we need to hire them. That's not the case. You have the right to go in, to talk to these care providers, to take up their time. It is your right to ask all of your questions until you get a good sense for if they're the right fit for you. So just remember that the person that needs to feel the most comfortable with your care provider choice is you. All right, so once you have found that ideal care provider, really all you need to do, especially if you're switching from, say, an OB to another OB, all you need to do is call their office and let them know the situation and ask that your records be transferred over to your new care provider. If you have a midwife that you are letting go of, that can be a slightly, trickier situation. You have to get a little bit more personal. With a doctor's office, you can just call, the front office and they take care of it. Usually you don't actually have to have a conversation with a doctor. With a midwife, you usually at least have to have that email correspondence. But again, remember, the discomfort that you have to go through now is well worth it to end up with the person that really is your advocate and will support you in having the birth that you want in every way possible. If you have any questions about this or any other questions about pregnancy, childbirth, early motherhood, go ahead and email me at the email address in the description below.